Hello and welcome to today's webinar, where we are going to be focusing on mitochondrial optimization. My name is Brianna Gregory, pharmacist and physician liaison with Physicians Preference Pharmacy, and I'm so glad that you've joined me today to discuss in depth a drug that we've been compounding for quite some time, compounded methylene blue. We compound methylene blue in oral capsule form. So we're going to be talking about how methylene blue has an impact on the function of mitochondria, optimizing mitochondrial function, and also helping to circumvent some of the portions of the mitochondria that may be broken. So as I mentioned, I'm one of the pharmacists with Physicians Preference Pharmacy, and I'm excited to discuss this with you because it's a product that I take myself. And I want you to understand further about how it works so that maybe you will try it yourself, and also so that you can recommend it to your patients with full confidence. So we're going to go ahead and get started. We'll be focusing on methylene blue capsules, and we'll discuss dosing and indications and some applications for your patients. So if we have not had the pleasure of meeting thus far, we are at Physicians Preference a non-sterile compounding pharmacy only. So we do specialize in oral and sublingual and topical and vaginal preparations. We always take a root cause approach. We want to be sure that we're never over-medicating the patient, but instead we come with new options, innovative options, which really help the patient heal from the inside out. So let's go ahead and jump right in. Let's talk about the history of methylene blue. There's a lot of buzz around it. I still get a lot of calls about it, and yet there's still some people that have never heard of methylene blue. So methylene blue is actually very, very old. It is in some contexts considered a repurposed medication, and methylene blue was originally developed as a blue dye way back in the 19th century for the textile industry. Now, if you've used it in the laboratory, you may know that it's helpful in microscopy identification, helping us to stain and identify bacteria, parasites, yeast, and other microorganisms. It's also used to address methemoglobinemia in the hospitals and found on the crash cart in hospitals. Interestingly, it also functioned as an anti-malarial medication and something that World War II soldiers were required to take to be sure that they were safe from malaria. And these soldiers were actually told to take the methylene blue, and I don't know whose job this was, but someone had to monitor them to be sure that their pee was blue. We'll talk about how that's effect of methylene blue when you take it orally. And also methylene blue is known as an antidote for chemical poisoning like cyanide poisoning or carbon monoxide poisoning. So what does nitric oxide have to do with all of this? For us to understand how methylene blue works, we need to have an understanding of how nitric oxide plays a role in the body. So nitric oxide is naturally produced by the human body. It functions as a vasodilator, and it plays a physiological role, however, in both health and disease. You may notice that some people, or you may read that some people have split opinions about nitric oxide's role in the body, but it is most notably reserved for times of stress. So when the body is under stress, nitric oxide kicks in and can provide some vasodilatory effects. So during emergency situations of hypoxia, it's released and actually functions as a substitute for carbon dioxide. Now, when we are exposed to excessive nitric oxide sources, we can experience an exaggerated amount of vasodilation and circulation. So nitric oxide turns off oxygen when it irreversibly binds to the critical respiratory enzyme found in the mitochondria, which in this case is the star of the show of what we're talking about when it comes to methylene blue. And this is cytochrome C oxidase. A cytochrome C oxidase is located in the electron transport chain, and it is necessary to help the electron transport chain do just that. Actions of methylene blue at low concentrations, which is what I'm talking about and we'll be discussing today, forms an equilibrium between an oxidized and a reduced form. This is what we refer to as an electron cycler. So we're always thinking about bringing the body back into balance and how to respect the natural balance of the body, in this case, the electron transport chain and mitochondrial function. And methylene blue selectively accumulates in the mitochondria, specifically in damaged areas of the mitochondria. And let's remember that mitochondria are highly concentrated in the nervous tissue. So this becomes important when we're thinking about certain patients in which we may use compounded methylene blue. Methylene blue increases mitochondrial respiration, and it does this by interacting with, as I mentioned, the electron transport chain. So in deficit, when the electron transport chain or the mitochondria aren't functioning up to par, methylene blue helps these electrons bypass where the breaks are in the mitochondria. So methylene blue bypasses the changes or the breaks in the mitochondrial function so that there can be contribution all the way to cytochrome C oxidase to produce more energy. And we're going to peel this back a little bit further so that you understand at a molecular level what I'm talking about and why that's so important. So the electron transport chain, this is one of our favorite diagrams, probably second to the Krebs cycle, right? Having to remember what happens where and when. But essentially, the electron transport chain is how mitochondria breathe. So right here is cytochrome C oxidase. As you can see, electrons get passed down the chain to cytochrome C oxidase. And they get pushed through complexes 1 through 4, and then through ATP synthase, which allows the body to make ATP or energy. So that's where methylene blue works. We oftentimes will refer to health span when we're talking about products like rapamycin or methylene blue. So if you're on the first part of this webinar, which was previously released, we discussed rapamycin. Rapamycin, also known as sirolimus, oftentimes will complement treatment regimens in patients that are using methylene blue, because these types of patients are often candidates for both. So we're trying to extend health span with both of those medications. So methylene blue does impact metabolism, and I'm talking about mitochondrial metabolism. So the function, the respiration, the oxygen consumption, like I said, ATP production, as well as glucose consumption, which becomes very important, especially in the elderly, and it acts as an antioxidant. So you may have heard that it has some function against pathogens, and I think that this is a really interesting aspect of how methylene blue works in the body. So it interferes with the life cycle of pathogens and reduces infectivity of not just viruses, but also parasites, bacteria, and fungi. Some examples include E. coli, Candida, hepatitis, HIV, fast forward, also COVID-19. So what about in malaria? We had talked about the World War II soldiers using it, but why is that important? And this to me is so interesting. So methylene blue is useful in malaria for this reason. So originally derived from quinine, which is isolated from the South African tree bark, is synthesized to make methylene blue, which was used in World War II, remember, becomes quinacrine, becomes chloroquine, becomes hydroxychloroquine. So methylene blue is actually the parent drug for hydroxychloroquine, which kind of connects the dots here for us. What about in Alzheimer's? A lot of times we will use methylene blue in those who have neurodegenerative conditions, memory challenges, and we see that it works well for many. So body-wide changes in bioenergetics, for example, like energy metabolism, can occur in normal aging individuals. And when we get the disturbed bioenergetics, that's actually important. And oftentimes the major contributor or a mechanism to underlying late onset Alzheimer's disease. Now, these cells show an impaired mitochondrial metabolic potential and abnormal redox potential. So we know that mitochondrial function is being compromised. Methylene blue does cross the blood-brain barrier, and also it is selective for damaged and distressed tissues. So it's smart. It's a smart compound. It goes to where it needs to go to fix the problem. Further documentation in Alzheimer's, we do know that There have been trials done for methylene blue and Alzheimer's. So a phase 3 trial in particular looked at patients with Alzheimer's disease that received it at a dose of either 150 up to 250 milligrams a day, or they got it at 8 milligrams a day, and that was the control group. 8 milligrams would be very low. So usually most patients will take somewhere between 15 to 50 milligrams a day, at least most of my patients do. The take-home point here is that more is not always better. So for these patients, methylene blue had pharmacological activity on the brain structure and function. But what we found is that the treatment benefit is actually somewhere around maybe even 15 milligrams a day. And that goes for a lot of different indications, including depression. That seems to be, for most people, not all, most people, somewhere around the minimum dose for them to have efficacy. So somewhere around 15 milligrams. All right, so continuing with methylene blue and Alzheimer's, I capitalize on this because Alzheimer's is one of the conditions that methylene blue has the most vast research in. Very interesting. So the enzyme that we are talking about, cytochrome deoxidase, is inhibited in Alzheimer's dementia. So the function is inhibited. What does that mean? And how do we know this? So a lot of research has been done in fresh brains of Alzheimer's patients who have passed away. If you're wondering why I have a picture of Sun City, Arizona down here, if you've heard of the Sun City communities, and this is where a lot of retirement people live. And so a well-renowned researcher, his name is Francisco Gonzalez Lima, had a contract with Sun City. His contract said that he could look at and have access to the brains, fresh brains, of Alzheimer's patients who had just passed away. Now, what we know is that neurofibrillary tangles and beta amyloid plaques are actually not related to cytochrome deoxidase enzyme inhibition. Patients with Alzheimer's disease exhibit mitochondrial dysfunction, metabolic changes such as impaired glucose utilization in the brain. So this is important because this is what we call diabetes of the brain. So when we have glucose hypometabolism, we really have issues at a metabolic level. These patients cannot utilize glucose properly, but they retain ketone metabolic capability. Excuse me. So glucose is the preferred fuel. However, these patients may increase their intake of sugary foods because they're looking for that type of fuel source to function energetically at a up to par level. This can actually lead to diabetes if they are ingesting too much glucose to meet their perceived demands. So one of the interventions that we can take here is that we can upregulate the function of that cytochrome deoxidase enzyme using methylene blue. All right, what about memory and cognition? So at just a daily dose of 15 milligrams, methylene blue actually works as a monoamine oxidase inhibitor. It helps to boost serotonin, excuse me, with reduced anxiety and depression, and improves mood and memory retrieval speed, concentration, and focus attention-related tasks. So this has actually been shown following just one dose of methylene blue, ranging between 0.5 to 4 mg per kg, and that's per day, usually once per day. Okay, what about in COVID? So we do know that COVID infection, as well as vaccination, can hijack host mitochondrial function. It also can manipulate metabolic pathways, and this mitochondrial dysfunction and the associated oxidative stress leads to pro-inflammatory cytokines. Now, these findings specifically pave the way to investigate further and whether or not restoring mitochondrial function and or targeting glycolysis can potentially be used for treatment of patients with COVID-19. And I would say, yes, it does. Okay. So what about cancer patients? I originally gave this talk, I guess, a year and a half ago in late 2022. And we hadn't started seeing an upcrop in cancer cases quite yet. Unfortunately, that's changed. It's turned a corner and we're seeing a major ramp up in cancer cases, largely due to COVID infection and vaccination. So we need to be aware of the inflammation that that's causing, as well as how that's impacting mitochondrial function. This specific study evaluated over 2,500 French cancer patients that were treated during the COVID-19 pandemic. None of them that received methylene blue developed COVID or flu-like syndromes. We do know that red light therapy in combination with methylene blue is referred to as photodynamic therapy. So when you combine the two together, it helps to drive methylene blue in further and be more efficacious. There's been some really interesting work done to see how these two complemented together specifically can have an impact on viral infection. So you can get these panels for your office. Someone can get them at home. I've got mine hanging on my door right here, just like this gentleman. And it's important for patients to utilize this therapy in a way that's going to maximize the use of methylene blue. So most of my patients, I'll recommend that they take the methylene blue orally about 30 minutes prior to red light therapy for maximum efficacy. What about in depression? So one specific study shows that severely depressed patients just given one dose of methylene blue 15 milligrams daily for 3 weeks showed significant improvement when compared to placebo. In autism, we know that one of the hallmarks of disease in autism is high oxidative stress. There is an autism gut disorder link. So think about this. Does excess production of endotoxins, you think, in autistic children causing inflammation, nitric oxide production, lead to metabolic dysfunction? In 2010, a landmark study at UC Davis found that those children with autism are far more likely to be deficient in their ability to produce cellular energy than healthy kids. So I'd say yes. What about for pain? So a few hours following oral methylene blue doses, painful inflammation of nerves have been shown to subside, and often entirely with further administration. Certain types of pain reduced include post-op pain, chronic shooting pain, refractory oral mucositis for chemo, arthritis, migraine headaches, the list goes on here. What about dosing? I get a lot of questions surrounding dosing with methylene blue. So I recommend starting pretty much anyone for any indication at 0.5 milligram per kilogram daily of methylene blue. 0.5 to 2 mg per kg per day is way in the safe range. I've seen people go up to 4 mg per kg per day. And some people even say that going up to 10 mg per kg per day would be still safe. I've never seen anyone dose that high, so I suppose that's theoretical. Now, dosing methylene blue does exhibit a hormetic response. What this means is that we get different effects in the body at low doses versus high doses. Low doses of methylene blue work as a nootropic, and high doses can actually promote free radicals. So for most indications, if you do the math on 0.5 milligram per kilogram per day, people will usually fall somewhere around the 35 to 50 milligram dose. And you can take it with or without regard to food. The time to peak concentration is about 1 to 2 hours after taking it orally with a 5-hour half-life. Most people do not dose it twice daily due to cost, so I try to do it all in one dose if I can. The patient will pay the price per capsule dispensed. Here are the doses that we compound. And when it comes to dosing, do your math, 0.5 mg per kg per day, and then round up. So if you get 13 milligrams, for example, from your math, I'd round up to 15. Always round up unless you have a highly, highly sensitive individual. So what about side effects? The first one is more of an effect than a side effect. Most people know that by taking oral methylene blue, that the urine is going to turn blue. Some people say, wow, I was surprised at how pretty it actually is. It can be like an aquamarine color, even a dark blue. Partially, that will depend on hydration status. Usually the blue pee will clear out after about 24 hours. And actually, when you get a couple clear urinations in a row, that's how you know methylene blue is out of the system. Side effects are very rare when dosed under 4 mg per kg. And some have reported an increased heart rate, which in that case, you may consider lowering the dose. Also have them take a look at their caffeine consumption while on methylene blue. They could be having an additive effect there. You do need to run a G6PD test on your patients before they can take methylene blue. If you find out that your patient is G6PD deficient, they should not take methylene blue. And I get a lot of questions about the concern of serotonin syndrome when methylene blue is taken in combination with other products, let's say like SSRIs. I say concern in quotes here because it's not a concern for me. Anytime that has been shown to be an issue with the patient has typically been in the hospital and reported cases of serotonin syndrome in those that received methylene blue pushed at about 14 times the dose of what I'm recommending on a daily basis while the patient is under anesthesia during surgery. So this is a very different type of situation. For your day-to-day patient who's concurrently taking an SSRI, yes, definitely warn them of what the signs of serotonin syndrome look like, but clinically, I would not be concerned about dosing them together. And hopefully, methylene blue can serve as a bridge to get them off of that. Don't recommend it while you're pregnant or breastfeeding, just simply because we don't know. And then as we wrap up, just to provide some final thoughts here, mitochondrial optimization is essential to increasing health span for our patients, right? So at low doses, which again, I recommend 0.5 mg per kg per day, selectively promotes mitochondrial respiration, cellular energy production, and reduces nitric oxide load. Works well in conjunction with compounded rapamycin. And at low doses, it also helps to support, congruently with rapamycin, mTOR inhibition, cellular autophagy, allowing the body's response to adjunct treatments to be maximized. So oftentimes we will use rapamycin and methylene blue together in the patient to help improve their health span. Here are some resources for you. Please do visit our website. You can see our formulary there, everything else we make, including doses. I'd love for you to hop on this virtual tour, which takes you through our pharmacy and our labs. We're very proud of those. Also, you can see our online drug catalog here, sign up for newsletters here, but also please contact me if you have questions about how to prescribe methylene blue. I can provide you the RX order form, which can be emailed directly to you so that you can send in prescriptions to us. You will be getting an email with information of how to prescribe, contact information, my contact information, phone, and fax. But please do feel free to reach out to me with any questions that you have. And I hope that this information has been insightful for you in prescribing methylene blue. Thank you.